contact tracing apps were supposed to save us. But as the country gradually reopens after lockdown and eases social distancing measures, many states are now seeing a surge in new reported coronavirus cases. And while some states are attempting to build their own manual contact tracing programs with armies of human tracers, there are still very few apps built to track the spread of the disease, even as Silicon Valley proclaimed the technology's potential.
Contact tracing is really about controlling disease spread. So if you imagine that the COVID-19 is spread by droplet primarily, and somebody has COVID-19, then the greatest risk of it spreading is to those that they've come in contact with when they're infectious. So we need to find those people and say, hey, you might have been exposed. You really need to quarantine yourself for 14 days because you might have COVID-19 and you might spread it to others.
Estimates say we'd need somewhere between 100,000 and 300,000 contact tracers nationwide for the amount of cases in the US.
Which is a lot of people, huge workforce.
And states are scrambling to meet the demand. Smartphone apps were supposed to help us bridge the gap. One of the most highly publicized programs was an API developed by Apple and Google. It's not an app itself. It's a set of protocols and tools that public health agencies can use in their own apps. Only 3 states so far have committed to using it. So what happened? At its core, the conversation is really about a trade-off between privacy and public health. While the Apple-Google API has received approval from even the staunchest privacy advocates, officials say its restrictions limit how effective they can be. For one, the API doesn't allow governments to collect any GPS location data. Instead, it operates on Bluetooth, which could theoretically keep identities anonymous by using unique, temporary IDs. These IDs would be generated by a person's phone once they downloaded the app and opted into the system. They would change every 15 minutes, and all data would be stored locally on users' devices. And so if 2 people running the app spent a certain amount of time near each other, say 20 minutes within 10 feet, or whatever public health officials decide, their phones would exchange IDs. If one of those people is later diagnosed with COVID-19, that person can opt to upload all of their IDs from the last 14 days into the app server. If there's a match, the app will tell you that you've been exposed to someone with COVID-19 and warn you to get tested or self-isolate. At least that's how it would work in theory.
It really is far too imprecise. You can't tell whether there was a wall between you and another person. You can't tell whether you're on the same floor quite often. I mean, if you've ever tried to connect to somebody else's Bluetooth appliance, you can see that it really isn't a substitute for the kind of thing that a contact tracer, a physical contact tracer, is trying to get to, which is, did you pass the virus to someone?
So there's the question of accuracy. It's not likely that this system will be able to tell the difference between 6 feet or 10 feet. And some public health authorities say the lack of location data doesn't help its human contact tracers know when and where transmission could have taken place. Then there's the question of adoption.
You also have to look at, before we even get to these guardrails, the fact that not everybody has a smartphone with the most up-to-date thing. So you're never going to get 100% of the people involved in this. And in fact, it's going to be slanted towards wealthy people, people who have the means. So how are we going to account for that when we know that many of the people who are most vulnerable to coronavirus are not that community?
The rate of adoption is extremely important. You need to have high adoption for these apps that do proximity tracing to have value, because if only 1 out of every 100 cases uses this app, then the app isn't going to be very useful for finding all of the cases. And I think there could be a false sense of security if I don't download an app as a community person and I think, oh, the app is going to tell me when I'm near a case when I go outside. So I'm kind of protected by it. But most of the people who our cases aren't using it, that's kind of a false sense of security.
So it seems like for now, the bulk of contact tracing will stay low tech, with people on the ground. But states still have to hire tens of thousands of more tracers to meet the demand.
These are all uses of resources. I mean, I think sometimes it's important to step back and wonder whether, just because you have tech, is that the thing that one should do in response to a crisis? And I think physical contact tracing is far more important. And the fact that we have a shortage of people who are doing this and we need to train them up, we can use all sorts of digital tools to help us train up people to do physical contact tracing. And I think get a lot better bang for our buck about how we're doing this than the apps.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.